All right, gang. We've officially made it to week 2. This week is still going to feel, I don't want to say a little bit slow, but we have to cover a certain level of base knowledge to get us all on the same page before we can really go too hard too fast, right? Many of you, actually all of you, should have had anatomy and physiology. It could have been recently, it could have been a while ago, but we need to make sure that we're all on the same page with planes of movement, with body positions, with terminology before we can really get going on some of the structural kinesiology things, like the objectives that we're going to have to get through this semester. So what I've done this week is we've divided the lectures into 2. So we're going to have 2 different video lectures. One video lecture is going to focus on kind of reference body positions and alignments and directions. The second is going to function on focus on body planes, planar movements, and how you can get to know movement within planes easier. So reference body position, you guys probably remember this, but anatomical position is going to be the most commonly and most widely used and most accepted. It is when an individual is standing, feet close together, palms facing forward, and facing straight ahead. So that is anatomical position. You can be in anatomical position laying down pretty much. Anytime that you see this position, it's anatomical position. Fundamental position is very similar. Just take and rotate those palms in so that the palms are actually facing the body rather than facing forward. There's several other body positions that are commonplace and that you need to know the term associated with the body position. I've listed them all here for you for ease of learning them and like flashcarding them, but let's move forward and see what are each one of these. So we're going to actually go through and I'll click back and forth so that you can read the definition and then see what the picture looks like, and read the definition and see what the picture looks like. Rather than have 100 slides for you guys to get through, I think it's faster to do it this way. Everyone should know that top left position is going to be the fetal position. So what is the fetal position? It's laying on the side, spine is flexed, head is flexed towards the chest, and extremities are flexed and drawn towards the torso, right? Head is flexed, back is flexed. I'm pointing to the screen because I'm an idiot and you cannot see my fingers. So let's now use the cursor, right? Spine is flexed. It's in flexion. The head should be in a little bit more flexion. The knee and the hip are in a flexion position. Knees drawn towards the chest, and the upper extremities are in a flexion position, right? Hook lying means that you are lying supine with the hips flexed to approximately 45 degrees and knees flexed to 90 degrees and feet flat on the floor. Boom. Right here, right? Hook lying position. So you are lying supine, hips at approximately 90 or 45 degree angle. Sorry, if you were to draw a straight line up from the hips, that would be 90, right? So it's approximately 45. And then if you draw a right angle right here, the knees are approximately at 90 degrees and the feet are flat on the floor. Hook lying position. Lateral recumbent position is going to be lying on the side. Knees and hips may be either straight or slightly flexed. And there's another term for this, and it's the lateral decubitus position. Good luck saying that. So here you go. You're lying on the side. You can have the hip and the knee slightly flexed as you have here. You're going to have a long sitting position, which I'm not going to lie, it makes me think that you're going to be sitting in the position for a long time, but I can tell you I'm a lot less comfortable in this position than I am in the short sitting position, if you will. What it's talking about the long length of the leg, right? So you're sitting in this position with the knee fully extended and the hips in flexion. So long sitting with the legs fully extended, toes pointed, trunk erect, and hands on hips. His hands aren't on his hips, but his trunk is erect. You're going to have sorry, I'm clicking through all these slides. Prone position, you guys should already know, especially if you're in the military. Prone is going to be laying on the stomach. Supine is going to be laying on the back. And then this position up here in the top right is going to be the short sit position because the legs are in a short position. And the definition of the short sit position is sitting upright with knees flexed and hanging over the surface of something. So short sitting in a seat, right? You're sitting in a chair, essentially. You're hanging your legs off of something, whereas the long sitting, your legs are long. In the hook lying position, you can kind of think that they look like a fishing hook, if you will. So there is a ton of reference lines to help us better orient ourselves on a human body. So it helps us understand specific locations better. So one of the first reference lines that you're going to need to learn are the mid-axillary line. So that is going to be a line running vertically down the surface of the body, passing through the apex of the axilla. That is literally directly down the armpit, right down basically the center of the ribs, if you will. You're going to have the mid-sternal line, which is going to be a line running vertically down the surface of the body, passing directly through the middle of the sternum. I've got pictures for all these on the next slide, don't worry. Then you're also going to have the anterior axillary line. So that's going to be a line that is parallel to the mid-ax, so the line running right down the middle of the ribs, cutting the armpit in half. But it's going to go through the posterior axillary skin fold. You're going to have, that should say, I'm an idiot, that should say the anterior axillary line should pass through the anterior axillary skin fold. I will change that. The posterior axillary line is a line parallel to the mid-ax line passing through the posterior axillary skin fold, right? Mid-clavicular line, clavicle means collarbone, so it's going to be in the midpoint of the collarbone, and it's going to be a line running vertically down the surface of the body, passing through the midpoint of the clavicle. So the midpoint of the clavicle would be from the AC joint to the sternal notch, basically, and it'll be a line that runs vertically there. Mid-inguinal is going to be a point between the ASIS, or the anterior superior iliac spine, and the pubic symphysis, so right in the middle of the pubis bone. The scapula line is going to be a line running vertically down the posterior surface of the body, passing directly through the inferior angle of the scapula. If you remember, the scapula is kind of like an inverted triangle shape, so that very bottom border, that corner is going to be where the scapular line runs through. And the vertebral line is a little bit easier to remember because it's literally going to run directly down the spine. Just like you guys guessed it, here is examples of what these reference lines are. So you can see that the mid-ax, this guy doesn't have any armpit hair, I guess it could be a female, but it's running directly through what would be the middle of an imaginary armpit right now, basically cutting directly down the ribs, directly down the center of the ribs. The anterior axillary line is going through the anterior portion of the axilla, and the posterior axillary line is still parallel with the mid-ax and with the anterior axillary line, but running through the posterior section of the axilla. The mid-clavicular lines are going to be running between the sternal notch, or the one side of the clavicle, and the other side of the clavicle, so right down the center. The mid-sternal line right down the center of the chest, right down the middle of the sternum. The scapular lines are going to be running from the inferior border of the inferior angle of the scapula in a vertical manner. The mid-spinal, or the vertebral line, is going to be running right down the middle of the back, which is what you see right here. And then your mid-inguinal point is going, or the inguinal line, if you will, is going to be between the anterior superior iliac spine all the way to the pubic symphysis. So it's going to be the middle point of those two, or of the line drawn between there. So I know that we're starting off kind of rough with, we're having to memorize a whole bunch of things. One of the best ways that I can have you guys study for this is going to be doing flashcards. Learning how you can use some of these words to direct you to where the lines are going to be. So, like, let's take, for example, the mid-clavicular line, even though we've already talked about it. Use the words to help you identify the location. If we're trying to use these lines to describe locations on the body, that means that we're going to be using essentially verbiage to help understand where it should be. So the lines in the name should help you understand where they should go. So midclavicular, it's on the clavicle and it's in the midpoint. Posterior axilla, the axilla is the armpit, so you know it's going to be running along the posterior border of the axilla. If you think about where the posterior of the armpit or the axilla could be, you have two options, right? You have a vertical line or you have a horizontal line. So far, we didn't cover any horizontal lines. So you can kind of go with a concept that it's going to be a vertical line. And you can try to remember that it's immediately parallel to the mid axilla and the anterior axillary line. When it comes to directional anatomical terminology, what I want you to think about is that we're trying to direct someone or give someone GPS directions or give someone MapQuest directions on how to get to a certain spot. Most of you guys are probably too young. I know a couple of you guys like Ben are a little bit older. So you remember the days where you didn't just type it into Waze on your phone and you actually had to write down directions like I had to when I was learning how to drive. These directional anatomical terminologies are going to help explain how to get to a position on the body or help us describe specific regions that we're talking about on the body. With that, just like you can combine north and east to make a northeast direction, you can combine like anterior and lateral directions, so that rather than just moving anterior or just moving, or like, I can't really point anteriorly on this 2D screen for you, but you can use it to describe a combination of two different directions. So anterior, anterolateral. So it's going to be forward or towards the front. It's also going to be towards the side. So it kind of gives you a general region. So if you think in an XYZ plane, you can kind of move in these diagonals as well. Superior is going to be higher. Inferior is going to be lower. Proximal is going to be closer to the origin. Distal is going to be closer to the insertion. It can also be closer to the torso and further from the torso. Lateral is going to be away from the midpoint, whereas medial is going to be more towards the midpoint. Cephalic is going to mean towards the head. Caudal, towards the feet. Anterior or ventral, towards the front. Posterior or dorsal, towards the back. So think the brain has a higher functioning than the feet when it comes to cognition. So the brain is going to be superior to the feet, which are going to be inferior for brain functioning, right? You're going to think it's a pretty good distance to get to your fingers from your chest, or it's a pretty good distance to get to your toes from your hips. So they're more distal. They're further away from a midpoint, or they're further away, more towards the insertion than they are towards the origin. If it comes to anterior, posterior, ventral, or dorsal, remember that the dorsal fin on sharks or on fish is on their back, right? There's certain ways that you can come up with trying to remember these directional terms, rather than just having to write it on a flashcard or draw, this is superior to this is medial to this. Try to use the words to help cue you on which direction you're trying to go. This is going to be, rather than read through these, I want to kind of highlight a couple of them and help you come up with like kind of ways to remember these. So we just went over anterior, but you can have antero-inferior. So antero is going to be the root word for anterior. Anytime you see antero, it's going to mean in front. So something is in front. It's further forward. And then you can combine that antero with something else. So it is in front but below. So it would be antero-inferior, because we know that the inferior direction is lower or towards the feet compared to towards the head, right? Antero-posterior. So it could be relating to both the front and the rear. So it could be slightly towards the front, but still towards the rear. Caudal we went over already. Caudocephalid means that it's directional, so it's going from the feet towards the head. So it's actually combining like the southernmost and the northernmost points. So it's running the long axis of the body. There's things like dexter. So why would something be, if it's dexter, what does that have to do with the right? Well, dextro, the root dex actually means to the right. In things like chemistry, if something is oriented in a right-hand manner, it's going to be dextro. So you can try to remember that Dexter, the serial killer, or Dexter's laboratory, which most of you are way too young to remember. Dexter always thought he was on the right side of things, even though he was killing people. He always thought he was doing it in the right way. So it's Dexter or Dextro is on the right hand side. Again, you kind of just have to memorize some of these things because they're directional terminology, and I apologize. I know that it's somewhat boring, but it's still super important. Now let's move on to some of our alignment variation terminology. So we're going to get into thinking, how can we describe alignments or describe abnormal alignments, if you will. Kyphosis, or you can have someone that's kyphotic. So that means that their upper back is rounded forward. So they're actually going to be, if you look at them from the side, their upper torso is going to be rounded forward and the shoulders are going to be sloped forward. And that's going to be due to an increased curving of the spine outward or backward in the sagittal plane. So if you think about the spine's shape, right, and you're looking at someone in the sagittal plane, which we'll go over in the next lecture, it means that their upper back is actually further extended backwards. So it means that they're hunched over, right? It means that there's an increased or excessive curving of the spine outward or backward, which means that top of the spine, which is naturally curving backward at the thoracic spine, is excessively curved. So it's actually going to round someone out on this top end, right? Lordotic or lordosis means that you have an increased curving of the spine inward in the sagittal plane. So literally take and flip it to the opposite. So if kyphotic means that they're hunched forward at the shoulders, right, at the upper back. Lordotic means that the hips are actually going to be rotated forward, almost like in an anterior tilt, because the spine might be normal up top, but if it moves in, that bottom of the spine is going to be moving in and forcing the lower back forward. Does that make sense? Scoliosis is going to be lateral curving of the spine, so it'll be in the frontal plane. So if you're looking at someone's back, and like from the back of anatomical position, essentially, their spine would be doing that, right? So it'd kind of be snaking up rather than it being in the sagittal plane, which is viewing it from the side. You'll be viewing this frontal plane change, almost looking snaky. Valgus, you'll see this pretty often in some athletes and in individuals walking or running down the road. And I want you to actually look for it, right? It is an outward angulation of the distal segment of a bone or joint, which means that it is outward angulation of the furthest away from the midpoint, or the insertion area is going to be outwardly angled. So that means their hips, if you imagine their hips are up here, their femurs are going to come in. If they're knock-kneed, or if they have valgus in the knees, their femurs are going to be pointed in, and then their tibia fibula are going to actually be pointed out. So their knees are going to come together, and then their shank, the bottom part of their leg, is going to actually be angled out. Varus is going to be an inward angulation of the distal segment of a bone or a joint. So where valgus means that the femurs come in, and then the shank, or the distal segment of the bone or the joint, like the shin bone, the tibia, the fibula, are actually angled out. Varus is the opposite. So they're bow-legged. So there is an angle that is drawn out from the ankles and then up into the hips. So their knees are actually further away. They're not knock-kneed. They're the opposite. They're bow-legged.